Okay, muscular trauma practice. Question 1. X-ray shows well-defined loose lesion within metaphysis and epiphysis of distal femur. Series of fluid level, most likely diagnosis, aneurysmal bone cyst. Fluid level, so aneurysmal bone cyst. Question number 2. Knee injury during football. Pain swelling is caused pain and swelling and the knee is blocking. Knee locking and inability to fully extend knee joint. Most common sign of injury is posterior horn of the middle meniscus. When knee injury during football and then there's knee locking and inability to fully extend knee joints, the most common sign of injury is middle meniscus, but which part of middle meniscus? Posterior horn middle meniscus. Question number 3. Fracture of the left neck of femur. Which fracture is the highest risk of avascular necrosis? Subcapital fracture. Neck of femur, highest risk of avascular necrosis is subcapital fracture. Question number 4. Stress fracture, and which would be most indicative of a posterior fracture? Luther zone of osteomalacia. Is extreme margin of scapula. Most indicated stress fracture in extreme margin of scapula will show luther zone of osteomalacia. Question number 5. Chest X-ray shows bilateral symmetrical absence of the lateral end of the clavicle. Please select the cause of these appearances. The inferior granuloma. The bilateral symmetrical absence of lateral ends of clavicles is not seen in granuloma as lymphoma. It is seen in rheumatoid arthritis. In all other clinical dysplasia may see, but not seen in inferior granuloma. All other options make sense, but it's not seen in inferior granuloma. In inferior granuloma, we see blood eosinophilia, and we may see in parietal bone of the skull there may be punch-out lesion, scallop lesion in the parietal bone of the skull. Number 6. Chest X-ray shows concave scalloping of the undersurface of the right, second, and third ribs. There is slight scoliosis of the inferior aspect of the thoracic spine, most likely causes NF1. Now, scoliosis of inferior aspect of thoracic spine, and then concave scalloping undersurface of the right, second, and third ribs. So this is seen in NF1. Number 7. Which forms of micromealic dwarfism considered to be the most severe? Thanatotropic dysplasia is the most severe form of dwarfism. Question 8. Fractures extend from the articular surface to the epiphyseal plate but not extending to the metaphyseal. What is Salter-Harris classification? Type 3. Question number 9. Suspicion of pneumothorax. Which would be the least supportive of this diagnosis? A poorly defined anterior cardiopulmonary sulcus. Now, in pneumothorax, the cardiopulmonary area is clear and we can see it. We can demarcate between the heart border and the pneumothorax, but if there is poorly defined anterior cardiopulmonary sulcus, then it is least supportive of pneumothorax. Number 10. Splenic injury following trauma, which favors pseudoaneurysm or active exacerbation. This is apparent on delayed imaging. Now, pseudoaneurysm, on delayed imaging, it does not show any exacerbation of contrast. So it is pseudoaneurysm. 11. Man with pain elbow fallen from a bicycle, which indicates underlying abnormality. The anterior humeral line passes through the anterior third of the capitulum. Now, when the patient has fallen from a bicycle, which shows abnormality when anterior humeral line passes through the anterior third of the scapulum, it shows abnormality. Question number 12. Chest X-ray shows solitary expansile right hip posterior rib mass. GC shows no excessive features, like diagnosed fibrous dysplasia. Now, fibrous dysplasia, how it looks like expansile right posterior rib mass, and then without any excessive features, so fibrous dysplasia is diagnosed. Question number, it only shows strong glass appearance, fibrous dysplasia. Question 13. Calcified mass centered within the soft tissue of the thigh, and the calcification is on the periphery of the mass. With loosened zone separating the lesion from the underlying bone, most likely diagnosed by ossificans. The calcified mass centered with soft tissue of the thigh, and then calcified mass with the muscle bone, and then muscles, and then there's calcification on the periphery of the mass, and loosened bone separating the lesion from the underlying bone, diagnosed by ossificans. 14. Pain from swelling of the limbs and joints, particularly knees, ankles, wrists, and elbows. Usual clubbing and joint fusion are noted. Pain graph shows marked bilateral smooth parachute reaction affecting the radius, ulnar, tibia, and fibula, which is not associated with the most likely defined diagnosis, Gaucher's disease. Now, this is the diagnosis, question number 14. The patient most likely suffering from hypertrophic osteoarthropathy, and secondary to conditions within disease within the chest. So within the chest. Now, Hypertrophic osteoarthritis is most likely caused due to pathogenic carcinoma and other diseases within the chest. The most unlikely to be associated with these symptoms, hypertrophic osteoarthritis, is Gaucher disease. 15. Which is not recognized feature of Felty syndrome, low titer of rheumatoid factor. Felty syndrome does not show low titer of rheumatoid factor. 2016, ankylosing spondylitis is suspected, which would be the least supportive of this diagnosis, calcification of the anterior longitudinal ligament. Ankylosing spondylitis does not show calcification of the anterior longitudinal ligament. It only shows bilateral sacroiliitis. 17. Pain film of the cervical spine, which is abnormal on the lateral view, the soft tissue anterior to C2 or 9 mm thick is abnormal. C2 9 mm thick is abnormal. 18. Which is more suggestive of avascular necrosis rather than transient osteoporosis of the hip. Double 9 sign on MR imaging shows avascular necrosis. Here, this double 9 sign shows avascular necrosis, or crescent sign shows avascular necrosis. 19. Which would feature a diagnosis of bacterial infection or Parkinson's disease, destruction of the articular cortex. Now, when articular cortex is destroyed, then it shows bacterial infection rather than Parkinson's disease. 20. RTA shows oblique fracture line is seen through the upper portion of the tens. Which type of right fracture is this? Type 1. And remember, head, body, base. Head, body, tail. So, upper portion of the tens involved, fracture, so type 1. Mid of the tens involved, body, type 2. And base involved, type 3. Question 21. Following penetrating abdominal trauma, which organ is most frequently injured? Liver. 22. With regard to outward rule for plain radiograph of the foot and ankle, which is incorrect? The answer is B. An ankle X-ray indicates if there is pain in the malleolar zone and bony tendons or the base of the fifth metatarsal. This is incorrect. Now, all other options are correct. This you have to memorize it. It is not only indicated when there is pain in the malleolar zone, but it is related to weight bearing. Patient cannot weight bearing, then we should do X-ray ankle is indicated. Okay, memorize this. This is not true regarding outward rule for plain radiography. Ankle X-ray is indicated if there is pain in the malleolar zone and bony tendons or the base of fifth metatarsal. 23. Which feature would confirm Maffucci syndrome as a diagnosis rather than Ollier disease? Soft tissue hemangiomas or soft tissue calcification will diagnose Maffucci syndrome rather than Ollier disease. 24. Wrist X-ray shows displaced oblique intra-articular fracture of the dorsal lip of the distal radius. What is the type of fracture? Barton's fracture. Displaced oblique intra-articular fracture of the dorsal lip of the distal radius is diagnosed as Barton's fracture. 25. Abdominal X-ray shows calcification in the left upper quadrant. The loops are ball in this region, central depressions in the superior and inferior end plates of L3 and L4, and a mixed lysis and sclerosis appearance to the superior aspect of the left femoral head, diagnosed sickle cell disease. Now look here, this is central depression of the superior and inferior end plate of L4 and L5. This shows H-shaped vertebrae. Central depression in superior and inferior end plate of L4 and L5 shows H-shaped vertebrae, and so if you show like this, so this is L3, L4 vertebrae. Then we show central depression in the superior and inferior aspect of the L3, L4 vertebrae, so it shows H-shaped vertebrae. This is seen in sickle cell disease. So central depression in the superior and inferior end plate of L4 and 5 and 3, mixed lysis sclerosis appearance, and then experience the superior aspect of left femoral head, so AVN of femoral head, diagnosed sickle cell disease.